Fluids and electrolytes. Here's 60% water, 40% intracellular, 20% extracellular, 15% interstitial, and 5% intravascular. When we talk about water, we talk about your blood, and in your blood you have electrolytes. Electrolytes are the ionizable components in your body fluids. They include potassium, sodium, calcium, magnesium, chloride, bicarbonate, phosphate, and sulfate. Homeostasis is something that your body wants to stay in. Sorry, that's homeostasis. A constant normal which is maintained within the body. Concentrations of electrolytes in the body are kept at a homeostatic level. If the concentrations in the body are not at homeostasis, the body does not function normally. It's all about the concentration of the stuff in solution. Osmolality and osmolarity are referring to the number of particles dissolved in serum. So osmolality is millimoles per kilogram, and osmolarity is millimoles per liter. Iso-osmolar, hypo-osmolar, and hyperosmolar are all comparative types of words. So hypo-osmolar contains fewer particles than water. Iso-osmolar, fluid has the same proportion of weight of particles and water. And hyperosmolar, the fluid contains more particles than water. When we talk about comparatively to blood, we talk about hypotonic, hypertonic, and isotonic. For our purposes, they're very similar. We're just comparing it, instead of comparing it to water, we're comparing it to blood for our purposes. That's not the complete 100% definition. However, just think of hypotonic, isotonic, and hypertonic as being things that are kind of similar to hypo-osmolar, iso-osmolar, and hyperosmolar. Tonicity, that's the concentration of IV solutions. Osmolarity and osmolality can deal with the concentrations of body fluids. Tonicity refers to the concentration of IV solutions when compared to blood. So we have isotonic, hypotonic, and hypertonic. Isotonic is anything that equals the tonicity of the blood. It equals the concentration of the blood. Hypotonic has less than the concentration of the blood. Hypertonic has more than the concentration of the blood. That's how we describe crystalloids. Crystalloids are IV solutions that have salts in them, that have electrolytes in them. Sometimes we put sugar in them, and those are crystalloids. Colloids, on the other hand, are generally referred to as volume expanders. These are things like hespan and mannitol and albumin. These things tend to bulk up the intravascular volume a little bit better than crystalloids, and actually a lot bit better. So examples of solutions with different tonicities. I think this first one, if we just put D5 rather than D5 half normal, then we truly have a hypotonic solution. Then normal saline is isotonic, and D50 is definitely hypertonic. We need to talk about the volume of fluid in the body too. Euvolemia is a normal amount of fluid within the body. These patients are in homeostasis and have normal body volume. Whereas hypovolemia, refers to low body volume of blood, and hypervolemia refers to high body volume of blood. Usually we're talking about the intravascular fluid when we're talking about volemia. Hypovolemia, too little fluid in the blood. Symptoms include dehydration, thirsty, little urine, dark-colored urine, fatigue, slightly low blood pressure, and tachycardia. Sometimes that orthostatic hypotension, severe dehydration, confusion, severe low blood pressure and tachycardia, dizziness and or syncope. Hypovolemic shock can ensue. Hypervolemia is too much fluid in the body. This is really a big deal when somebody has renal failure and CHF. You can hear crackles on auscultation, difficulty breathing, and shortness of breath. Some facilities will look at it as shortness of air. Edema, high blood pressure, cough, jugular vein distension, and strong bounding pulse are all symptoms of hypervolemia. When we're looking at fluid overload and pulmonary edema, sometimes that happens with hypervolemia, and sometimes we'll talk about frothy sputum when it comes to that. Please refer to the handout for electrolyte values and signs and symptoms of low electrolytes versus high electrolytes.